Are we live? Are we recording?
Yeah, we are live. Yes, we can go ahead.
Okay.
All right. Assalamu alaikum. My name is Atia. I'm going to be the host for today's discussion. I want to introduce Dr. Okubanjo. If you want to introduce yourself.
Hi, good afternoon, everybody, or good evening. My name is Oyin Consolo Cabanjo. I'm an emergency medicine physician at Advocate Christ Hospital on the south side of Chicago, and sometimes at Trinity and sometimes at other hospitals, but mostly at Christ. I basically focus on community outreach, diversity, equity, and inclusion, and I'm really excited to be a part of this conversation. I'm also Yoruba, so also that.
All right, thank you. Sister Rukayat, if you want to introduce yourself, she's going to be our translator for tonight or today.
Hello, Assalamu alaikum, and good afternoon to everyone. My name is Adedo Rukayat. A
little bit of technical difficulties. Okay, so basically what we're going to be doing tonight is just any questions that anybody may have about the vaccine in general, we can ask you and get an answer from you. And then if anybody needs the translation in Yoruba, Sister Rukaya will translate your responses in the question in Yoruba if needed.
Perfect, sounds great. I'm really excited to have this conversation.
Okay, so does anybody have any questions that they want to start off with?
Yeah, my name is Fatima, and can I ask a few questions to begin with? So, Dr. Okubanjo, lately we have heard quite a bit of side effects for the second dose of Moderna, not as much as Pfizer. How do we compare, and what are some of the things we should be aware of?
I think it's really important to designate the difference between a severe reaction and side effects. A severe reaction would be something that would prevent you from getting repeat doses of whatever vaccine, whether that be Moderna or Pfizer, if necessary in the future for like boosters. Severe reactions would be things like shortness of breath, things like a severe rash, things like I feel like my throat is closed, and basically severe allergic reactions. Side effects, on the other hand, are sometimes associated with some vaccinations, and you have to balance out what those side effects for you are. The majority of side effects still with Moderna and Pfizer are still the pain at the site, fatigue for several hours. Some people, unfortunately, that fatigue can last up to 2 days. Some people do complain of a headache. And the most severe side effect that I've come across is people who have like muscle breakdown. And to be quite frank, anyone could have muscle breakdown from anything at all, including if you work out too long and you don't stay hydrated, then you can have muscle breakdown, which causes fatigue. The way that that's treated is with IV fluids. So in terms of the side effects for the Moderna that are more so coming out, if you actually look at what a lot of these side effects are that are coming out, most of them are more so similar to things like panic attacks, as opposed to any type of severe side effects associated with them. So those effects, it's also important to state that you have those side effects with many other things. If you take caffeine, for example, right? If you take caffeine supplements, you can have those exact same side effects as well. So when we start to talk about side effects with these vaccinations, I think that we have to look at this vaccinations in the same way we look at other medications, other treatments in medicine, is that there's a balancing act in general. And some medications do come with side effects. That's why they come with warnings. And we continue to find out more and more as we go on. But these are not critical, severe things in the sense that they should therefore mean that you do not get vaccinated.
I actually have a question. So one thing I've seen like on social media, like Twitter, for example, is that some women have had heavier cycles after getting the vaccine, whether that be Moderna or Pfizer. they've noticed that they've had heavier or longer cycles. Is that one of the side effects of the vaccine?
So that's not really a very common side effect that I've come across, to be honest. I have seen that some people in particular have swollen lymph nodes associated with the vaccine, and that kind of scares some people that it means that like masses are developing or things like that. But what your lymph nodes do is your lymph nodes are basically the houses of your immune response. So anytime you get any type of flu, viral infection, if you have a sore throat, you can touch underneath your chin and you can notice that your lymph nodes are swollen. And those usually go away. And you still have the same thing that can happen with Pfizer and Moderna, is that your lymph nodes can get swollen around the area that you got the vaccine. So a lot of women would get swollen lymph nodes in their armpits. And what we say is that if you're due for your mammogram, for example, you might want to reschedule your mammogram at a later date, at least 3 weeks out, because it can lead to a false positive mammogram. And it's not actually positive, it's just because the lymph nodes are swollen. Now, in regards to heavier cycles, in order for you to get heavier, longer cycles, that would mean that the vaccine is changing your inherent hormones. And for women in general, the women that are saying that maybe they're having heavier cycles, maybe they're having longer cycles, if you have a stressful day, you can have a heavier cycle. If you have a longer day, you can have if you have anything can change those hormones and can change those levels and can change the cycle. In order for something to change that permanently, that would mean that the vaccine is acting in a space which is the hypothyroid and the pituitary gland, and that vaccine doesn't go there. There's nothing that the pituitary gland does that is regards to regulating our immune response. So our immune response has nothing to do with that gland. So in order for the vaccine to be changing what a woman's menstrual cycle looks like, that would mean that it has to have effects on that, and it doesn't do that. Whereas if I don't get enough sleep, I could be affected that way and my cycle can change too. So I caution everybody that it's important that you kind of look at everything from a space of what have I experienced in the past just regularly? And am I just looking for a reason to blame the vaccine for changes that could have happened regardless?
It looks like thank you for answering my question. It looks like we have a question in the chat. Abdurrahman says, I've been seeing statements by Pfizer saying that a third shot will be required soon. Will that be the case for the other vaccine brands as well? And what does this mean about how often we will need booster shots?
It really is looking like we might need boosters at least yearly, similar to the flu vaccine, especially with all of the vaccinations period. And the reason why is that there are different strains and basically different versions of these viruses. As viruses stay in the community at large longer, they mutate and they mutate and they mutate. Right now, there are 4 different strains. There's a US strain, a UK strain, a South African strain, and a South American strain, right? When everything was first started, there was only one type of strain. So Pfizer Moderna was really targeted at that one type of strain. When J&J came out, there was already the 4 strains. So they were able to test it against the 4 strains. They did test Pfizer Moderna against the 4 strains, and it works for the 4 strains as well. But the fact of the matter is that we're not going to probably just stop at 4 strains. The virus isn't going to say, I've done 4, that's enough. Viruses are smart. In order for them to continue to survive, they have to continue to change, to propagate. So there will be more strains. And similar to how there's a different flu strain every single year, and we get a different, like the flu vaccine, but for different strains every single year, that's going to be the same thing that we likely have to do. I'm not exactly sure how often this would be, but as of right now, from all the research I've done and what I've been hearing in the medical community, it's likely that it's going to be a yearly thing, that by the end of this year, we probably will need a 3rd booster because we already have 4 strains, who knows how many strains. And the way you determine if you need boosters is the strains that we have, the new strains, you test it against the current vaccine. And if the current vaccine is still at a high enough level of immunity against those strains, then you don't need a booster. But if it's not, then you do need a booster that is targeted towards these newer strains. No, absolutely.
This this is really good information. I'm hoping that Sister Ruqayya, would you be able to translate some of it to address the questions in Yoruba? I'm sure she looks like she's still having some technical difficulties on her end.
Yeah, I'm in now. Thank you.
Okay. Were you able to catch Dr. Oyenkansula's answer about the different types of strains, and would you be able to translate that into Yoruba? We'll move on, I guess.
What I can do after is if you put all the questions in the chat, I can make sure that they're answered, and maybe, and I can answer them in the chat as well. So maybe we can read through them after in Yoruba, if that's okay.
Yeah. I mean, if
No,
it's
Sister Fatima, please, I'm unable to catch your question. Yeah. I think
oh, okay. Oh, you couldn't
yeah.
catch the question. Okay, maybe perhaps the next time when people ask the question, then you could answer, or you could translate that into Yoruba. Okay. So inshallah, we'll keep moving forward. So I hope, Atiya, your internet stabilizes. I don't know what to do.
Yeah, it just cut out a little bit, but it's fine now.
Okay.
If you don't mind, I have another question. So I've heard a lot about healthcare workers, especially like nurses and doctors, are experiencing hesitancy towards the vaccine. How, like, have you observed this in your hospital that you work in, and how have you tried to address this, or how do you think that people should address this?
Yeah, absolutely. I definitely experienced it. I experienced it firsthand. So I was one of the first people to get the vaccine at my hospital, and I was really, really excited. And I have a group chat full of other physicians. Most of them are African-American physicians as well, across the board: surgeons, pediatricians, adult docs, kids doctors, everything, right? And I was like, oh my God, I'm gonna go get the vaccine. And I was really excited. And all my friends, a good amount of them were like, oh, I can't wait to get mine either. And some were like, I'm not getting it. I was like, wait, what? What do you mean you're not getting it? You're a physician. You're a frontline physician. You see this, and the people that said that they weren't getting it, they were like the intensive care doctors. So like, besides the ER doctor, the intensive care doctors are the ones that really, really, really take care of these very sick people, right? I'm like, you've seen what COVID has done, and they're like, I just don't trust it. I don't understand. I still need to do my own personal research, Let us know how you feel after you get it, right? So I got the vaccine, and the first thing I texted them was, guess what, guys? I didn't grow a tail. I'm fine. And we all laughed about it. But then we had a really serious conversation, right? And our serious conversation really was like, first of all, we understand the hesitancy of why people, including physicians themselves, are hesitant, nurses themselves are hesitant. And I think that for some reason, sometimes people forget that we are people too, despite the work that we do, that we also have the same fears that our patients do, except we have access to so much more information, right, than our patients do. Our patients need to come to us for that information. So we sat together and we actually read through the data and the research for both Pfizer and for Moderna. And then we had an open discussion about what were we concerned about? What did it really address our concerns, and what risks we were willing to take, right? Like, were we willing to risk getting COVID? And at this point in time, it had already been something that some of us had already gotten COVID, and we're still having some sickness still from the COVID, the long haulers, they're called, or the post-COVID syndrome, where you still have continued effects of having the virus. Some of us were just waiting for our turn to get COVID. Like, we were like, getting COVID was inevitable. And we had already seen how badly people did getting COVID. So we had to really decide for ourselves, like, are you willing to get COVID? Because probably would, right? We take care of nothing but COVID patients. So eventually we'll get it ourselves, no matter how safe we kept ourselves, no matter the mask, no matter the N95s. It just is what it is. It's just part of the like high risk environment we're in. Or are you willing to take a vaccine that, yes, it seems like it was developed fast, but it actually wasn't, because what they did was they cut out all of the little minute things that usually slows down development of any type of medicine. You know, they slow down all the governmental policies about it and those things. And are you willing to take a vaccine that could protect you from a more serious illness? And most of us did. One of us, it took a month after the vaccine was offered before they finally did. And when they did, just a huge relief of getting those vaccines. But we still have a lot of nurses, a lot of doctors that are saying they're not willing to take it. But those people also are people that also, when COVID was, I mean, COVID is still very high, right? But when COVID first started and we didn't know what we were doing and what we were dealing with it, those same people did not come to work. So I think that they figured out that they're going to protect themselves by not putting themselves at high risk. And so if they're not working day to day with patients with COVID-19, maybe they feel a lot safer not getting the vaccine, despite the fact that COVID is in the communities. But a lot of people just really need some time. And I'm always in the space that you have to meet people where they're at. You know, they might not be ready today, but maybe in a month's time, they would be ready to get the vaccine. And we can't judge people or pressure people if they're not ready to get it yet. All we can do is provide information.
Sister Rukaya, if you want to translate that into Yoruba.
Yes, ma'am. Yeah, the question is, kí ló dé tó jẹ́ pé a rí dájú pé ní àwọn hospitals kankan, àwọn doctors àtàwọn nurses wọn ò fẹ́ gba vaccine yẹn. So a mọ̀ bóyá ní hospital tí Dr. Okubajo wà náà, bóyá wọn ò fẹ́ gbà níbẹ̀ náà. So tó tọ́ káàkiri náà, àwọn ẹlòmíín wà tó jẹ́ pé wọn ò ní lọ́kàn láti gbà, wọ́n ń bẹ̀rù pé àti bá gbà ṣó máa pa mí lára, ṣó máa ní mí lára, ṣó máa ṣe ìpalára kankan fún ara mi àbí fún ọjọ́ iwájú. So nítorí bẹ́ẹ̀ ẹlòmíín wà tó jẹ́ pé kò fẹ́ gbà gan, tó jẹ́ pé wọ́n jọ wà ní ìdíṣẹ́ ká máa tọ́jú àwọn ènìyàn. Ṣùgbọ́n ṣá láti ara pé wọ́n ń tọ́jú àwọn ènìyàn náà, gbogbo wa náà ni èèyàn ẹlẹ́ran ara. Dókítà mi máa sọ pé òun ò fẹ́ gbà, ẹlòmíín máa lóun ò fẹ́ gbà. Gẹ́gẹ́ bí Dr. Okubajo ṣe sọ, wọ́n ní àwọn kan wà tó jẹ́ pé wọn ò fẹ́ gbà ní ọ̀dọ̀ wọn. Ṣùgbọ́n ṣáńgbà tí wọ́n ṣe àyẹ̀wò lórí ẹ̀ tó fi ṣe èyẹ tó fi ṣe gbá, táwọn kan ṣàyàrí pé àwọn onígbà. Gbà tí wọ́n wá padà gbà tí Dr. Okubajo gbà, wọ́n ní àwọn ti gbà, kò dẹ̀ ṣàwọn ní ìpalára kankan, àwọn wà òkè, kò sí problem kankan. Ṣùgbọ́n ṣá síbẹ̀síbẹ̀ náà àwọn kan ṣì ń wò pé àwọn ò ní gbà. Kó tó di pé àwọn náà gbà náà, wọ́n jókòó, wọ́n yẹ̀wò dáadáa, wọ́n gbá research lórí ẹ̀. Ṣé tí n bá gbà, ṣé ó ní ìpalára tó fẹ́ ṣe fún mi ni, àbí kí n gbà kí lè dènà àìsàn COVID yìí ni, àbí báwo? Ṣùgbọ́n ṣá nígbà tó gbà tán, kò ṣe pé wọ́n rí nǹkan kan tó lera àbí nǹkan kan jù bẹ́ẹ̀ lọ. Síbẹ̀síbẹ̀ náà, lára àwọn tí wọn ò fẹ́ gbà gangan náà, gbà tí kinní kọ́kọ́ bẹ̀rẹ̀ ní 2020 tó jẹyọ, gbogbo ọ̀pọ̀lọpọ̀ wọn ò wá síbi iṣẹ́. So ọ̀pọ̀lọpọ̀ wọn ti mọ̀ pé tó bá kó tún ṣe pé ó pọ̀ sí náà báyìí, àwọn ò ní wá. So wọ́n mọ̀ pé táwọn ò bá lọ síbi iṣẹ́, àwọn ò lè kó. So fíbẹ̀ náà ẹlòmíì ò fẹ́ gbà, àwọn ẹlòmíì tó dẹ̀ lè gbà náà gbà. Àti pé tá bá rí èèyàn tó yẹ pé wọn ò fẹ́ gbà, tí wọ́n ń rò pé àtàwọn bá gbà ṣé kò ní pa wọ́n lára àbí ara àwọn ní ọjọ́ iwájú, a lè ṣì fi wọ́n lẹ̀kọ́ tó bá ti tó àsìkò, because a lè fi tipátipá mú wọn kọ́ wá gbà. Ṣùgbọ́n tó bá ti wá tó gbà tó bá máa gbà náà, fine. So a máa fi wọ́n sílẹ̀ ní kọ́ rò ó, a máa jẹ́ kó yé wọn náà ni, a bá wọn sọ, torí pé kò ṣe gbogbo èèyàn ló máa fẹ́ gbà. Ìgbà tó bá máa gbà náà sí, kó jẹ́ pé ó wá láti ọkàn wọn, bọ̀ ká jẹ́ kó mọ àǹfààní tí vaccine yìí máa ṣe lára wọn tó bá gbà, àti tí wọn ò bá gbà, irú ìpalára wo ló máa jẹ́ sára wọn. Ẹ ṣé, thank you.
I'm sure that was very good.
No, it was amazing.
Do you understand what I say?
I can understand. I can understand Yoruba very well. I just can't speak it, which I know sounds so backwards, but I can understand it extremely well. So yes,
Okay.
very, very, very well. So good.
Okay. I have some questions that is coming from the community. I don't know if I can just throw the question here now.
Okay.
Please.
All right. Please, Dr. Okubajo, what is the relationship between this vaccine? Because I heard of someone that had the vaccine. Actually, she's been waiting to get pregnant for a while now. But someone just came up to her and was like, though she works in a, what was it called? A nursing home. Yeah, she's also a first responder. So someone now told her that, why did you have to take this vaccine? It's going to do this, do that to your health, you that you've been waiting to have a child for a long time now and all that. Because of this, the husband, I did everything possible to just, to persuade the husband to get it. The husband said no, that even his wife that had a vaccine, he's still feeling bad or something about it. Is there any relationship between the vaccine and fertility?
So yeah, that's a great question. No, there is not. There is not. Actually, the ACOG, which is the Academy of OBGYNs, actually recommends the vaccine. Not only do they recommend the vaccine while you are trying to get pregnant, they recommend it while you are pregnant. They also recommend it while you are breastfeeding. ACOG recommends it very much so. And the reason in doing so is that you have to think of, why do we have these vaccines in the first place, right? We have these vaccines because we're trying to prevent the COVID-19 virus. And the COVID-19 virus has been seen to be passed to children, has been seen to be passed while women are pregnant, and we still don't know what those side effects on those children are going to be years down the line. Whereas the vaccines themselves have not been seen that way. The vaccines have no effect on immunity. As far as we know right now, they don't have any effect on any type of fertility. They don't have any type of effect on a developing fetus, and they don't have any type of effect on breastfeeding. The hope actually is that if the mom can have antibodies already created after being vaccinated, that this would also safeguard the baby from the COVID virus itself, because normally women, they pass on antibodies to their children anyway in the first breast milk that they produce, right? That's actually the best thing for the babies, like the first breastfeeding, that is everything that has all of the immune protectors and everything, and that's the stuff that's going to protect the baby for the first 3 months. And women who've had the COVID-19 virus, survived and made their own antibodies, were able to pass on antibodies to their children to safeguard them, versus women who actively had the virus while they were delivering. Oftentimes their children did also get the virus. And even though we still don't know the effects, we have seen what COVID has done in young children, not newborns necessarily, in young children. And it presents this very odd syndrome, which is a really scary viral syndrome for the children who are unfortunate enough to get the virus, and they get really, really, really sick. They have to stay in the ICU, and a lot has to be done for them, and you just hope that they survive. Whereas the vaccine can safeguard those fears. So no. If you look on the ACOG website, which is, they are the people that make the recommendations for, yes, you can take Tylenol while pregnant. No, you cannot take ibuprofen while pregnant. Obviously, don't drink while pregnant. All of the rules as to what you should be doing when you're trying to prepare yourself for pregnancy, during pregnancy, and after pregnancy is by ACOG. And they recommend both the Pfizer and the Moderna vaccine.
Okay. Fún gbogbo àwa tí dé pé à ń lérò lọ́kàn wa pé tí n bá gba abẹ́rẹ́ àjẹsára COVID-19 yìí, ṣó ní ìpalára tó máa ṣe fún mi? Bóyá mò ń wá ọmọ, àbí mò ń gbìyànjú, mò ń gbèrò lọ́kàn mi láti lóyún. Ṣé àbí mo tẹ̀ tí ń bẹ̀rù pé tí mo bá gba vaccine wọ́n ní àkókò dá fẹ́ni tó ń wá ọmọ, àbí kò dá fún ẹni tó bá lóyún. Vaccine yìí, pẹ̀lú àyẹ̀wò tó ti ṣe lórí ẹ̀, kò tí ì sí ìpalára kankan àbí nǹkan aburú kankan tó máa ṣe fún ẹni tó ń wá ọmọ. Kò dẹ̀ sí ìpalára kankan tó máa ṣe fún ẹni tí ó lóyún, torí pé kí ni, àìmọye àrùn míì tó jẹ́ pé èèyàn máa ń gbé látara inú oyún, tí ọmọ náà máa gbà látara ẹ̀, torí pé ẹ̀jẹ̀ báwo ló ń sọ, ẹ̀jẹ̀ kan náà ni. So ó dáa ká gbà nínú oyún náà, ó dẹ̀ dá torí pé lóyún ò ní pé ká bẹ̀rù ká má gba vaccine yìí, torí pé torí ẹni tó lóyún náà, àìsàn yìí ń bàjà, àìsàn COVID-19 yìí ń bàjà. ẹni tó dẹ̀ ń wọ ọmọ náà àìsàn COVID-19 yìí ń bàjà pẹ̀lú àyẹ̀wò àti gbogbo nǹkan tá a ti rí lórí ẹ̀ kò tí ì sí nǹkan tí ò da tí abẹ́rẹ́ àjẹsára yìí lè ṣe fún ẹni tó ń wá ọmọ àti ẹni tó lóyún sínú. Ó dá gan kan gbà tó a lè ṣe àbójútó ọmọ tó wà nínú náà àti fún gbogbo àwa tí à ń rò lọ́kàn wá pé àmì ò ní gbà fún láti títí di àsìkò yìí gbogbo àyẹ̀wò tó ti ṣe lórí ẹ̀ àti gbogbo àgbékalẹ̀ àgbéjáde tó ti ṣe lórí ẹ̀ táwọn àwọn elétò ìlera káàkiri ti ṣe kò tí ì sí ìpalára kankan tó fẹ́ ṣe fún ẹni tó lóyún àbẹ́ni tó ń wá ọmọ.
But yes, I mean, I really do understand, especially if someone has been trying to have a child and has not been successful, wanting to do everything to safeguard, like wanting to do everything to keep yourself as healthy as possible, right? To allow for that possibility to happen. And getting the COVID-19 virus is a risk that we're all taking, including those who are trying to get pregnant. So you always have to balance it out. Is that what am I willing to risk? I'm trying to get pregnant. I'm trying to create a healthy space and a healthy womb in order to facilitate fertility, right? In order to carry a child to the fullest of health. This is all I've wanted, especially if you've been trying for some time. So I absolutely understand the fears. Then you have to ask yourself, what risk am I taking with getting the COVID virus itself, and what damage can that actually have on if I'm even able to, after surviving the virus, God willing, right? First, you have to look at your risk of getting the virus, then look at your risk of surviving the virus, then look at your risk of all of the post-COVID syndrome that happens with the people who do survive the virus, then look at, I might likely to have some other complications because I had the COVID virus, versus what risk am I willing to take to get the vaccine to prevent all of those other risks, associated with the virus. But if someone is trying to get pregnant, it is recommended by ACOG. It does not affect fertility, but I do understand the fears. But I also think that anybody who wants to, who's worried about fertility is probably not doing a lot of stuff, probably not drinking, caffeinated beverages, because if you look at research that has been out there before, it's been, if you drink too much caffeine, it lowers your fertility. And that was proven to not be true, but people still would not drink caffeine because they don't want to lower fertility. So I understand the fears.
I remember a question from earlier that Sister Rukaya asked about when will children under the age of 16 be able to receive the vaccine?
So the last time I checked, it was May 11th, but I already know that there are some clinics that are already vaccinating 16 and up. That started vaccinating them this week, actually. So the initial date that was put out there was May 11th. But there are some places that are vaccinating 16 and up. So the only vaccine that is available and right now okay and has been tested in people 16 and up is the Pfizer vaccine. Moderna is 18 and up. J&J, which is on pause, which we can talk about, is 18 and up as well, but there is active research going in now for both Moderna and Pfizer for 11-year-olds to 16-year-olds as well, to see if it is also safe in that age group to release it to them. But so yes, you can actually find some places right now, some places under the Advocate banner are actually vaccinating 16 and up. As of before this, if you were 16 and up and you had certain medical conditions, you could get vaccinated regardless. But the open date for everyone to be vaccinated was initially May 11th, but now more places are opening and allowing people to be vaccinated even without medical conditions. You just have to call.
Fún àwa tí a ní àwọn ọmọ bíi ọmọ ọdún mẹ́rìndínlógún tí à ń rò pé ṣé ọmọ mi náà bí a hùwà lọ́kàn kọ́mọ yẹn gbà, ṣùgbọ́n ṣé ọmọ yẹn ò tí tó èjì kò tí tó iye ọdún tó jẹ́ tó fi lè gba abẹ́rẹ́ àjẹsára yẹn. Nǹkan tá a gbọ́ tẹ́lẹ̀ lórí ẹ̀ ni pé ọmọ tó bá jẹ́ ọmọ ọdún mẹ́rìndínlógún May 11 ni, so yẹn ní ọjọ́ 11 oṣù karùn-ún ni a gbọ́ pé wọ́n máa fún wọn. ṣùgbọ́n ṣá bá ṣe ti ń gbọ́ nísìn báyìí àwọn hospitals kọ̀ọ̀kan àti àwọn ilé ìwòsàn kọ̀ọ̀kan wọ́n ti ń fún àwọn ọmọ tí ó jẹ́ ọmọ ọdún mẹ́rìndínlógún yìí tó jẹ́ ọmọ 16 years ṣùgbọ́n ṣá fún àyẹ̀wò lórí ẹ̀ a ti rí pé Pfizer vaccine yẹn abẹ́rẹ́ àjẹsára Pfizer ni wọ́n ti ń fún ọmọ ọdún ní wọ́n ti gbáyẹ̀wò ẹ̀ jáde fún ọmọ ọdún mẹ́rìndínlógún tó jẹ́ ọmọ 16 years ṣùgbọ́n ṣá Moderna náà ti ṣe àyẹ̀wò fún ọmọ ọdún méjìdínlógún tó jẹ́ ọmọ 18 years ó tún wá jẹ́ pé àwọn ilé ìwòsàn kọ̀ọ̀kan náà tó ti ń fún wọn ní abẹ́rẹ́ àjẹsára ọmọ tó bá jẹ́ ọmọ 16 years tó ní àwọn àrùn míì àìsàn míì tó jẹ́ pé ó lè jẹ́ ìpalára fún tó bá tún ní COVID so wọ́n ti ń fún wọn so èèyàn lè yẹ̀ wò bóyá lórí fóònù wa àbí lórí ibikíbi láti ṣe àyẹ̀wò yẹn wọ́n ti lè gbà ní àwọn ibi tí wọ́n ti ń fún àwọn ọmọ ọdún mẹ́rìndínlógún ní abẹ́rẹ́ àjẹsára wọ̀nyí so.
Thank you.
I wasn't sure if she cut out or not.
No, it's done. So I'll give you a thumbs up whenever it's done. No, it's good.
And please, Dr. Bajo, is there any interaction with this vaccine with other drugs, like maybe like contraindications with other drugs with the COVID-19 vaccine?
So as far as we know, no, not yet. No, we have not seen any contraindications. The actual thing that people get allergic to itself is not even the vaccine itself, it's with the stabilizers. So a lot of times whenever medications are developed, whenever any type of treatment, whenever any type of vaccine is developed, is that in order to allow it to travel, you have to be able to stabilize it. So you add in other things like usually like fats, like lipids, polymers, also kind of like these fat bodies, and to kind of keep it in this stable structure. And some people end up being allergic to the stabilizer itself, but you can't separate that from the vaccine, right? So usually if people do develop a serious adverse reaction, like I had mentioned before, shortness of breath, rash, any type of swelling of their lips, throat, mouth, anything like that, right? Things that will qualify as an allergic reaction, it's to the stabilizer, but because it comes as one, you just recommend that they don't get the rest of the vaccine. Now, those stabilizers do not interact with any other medications. So, before people thought, oh, I shouldn't take ibuprofen before I go get the vaccine because ibuprofen is an anti-inflammatory, but that's not true. It doesn't work that way. So even people who were on immunosuppressive medications can take this vaccine at the same time. The only thing that we do say is that if you've gotten another vaccine, wait 2 weeks after that first vaccine to get the first or the second dose of the Pfizer or Moderna. And the reason is that your body needs an adequate amount of time to mount an immune response. So we don't want to overwhelm your body while it's already responding to one vaccine. Let's say you got the tetanus, like the tetanus booster, right? We want to give your body enough time to mount the response that's appropriate to get in that booster versus then compounding it with an additional vaccine.
So my second question is, please, is there anything someone needs to do or not to do immediately after getting the vaccine?
So after getting the first vaccine, any day that you get the vaccine, I would recommend that you take that day off just to see what effects you could possibly have, what side effects you could have. Some people after the very first dose, 0 effects, nothing. They felt just fine, myself included. Some people after the second dose felt really tired. And when I say really tired, like you're like, I need to lay down and take a nap. And you take a nap for like 3-4 hours, you feel better. You wake up and you're just fine. Some people got feverish. Some people got nauseous. Some people got a sore throat, things like that. So just because you don't know exactly which gamut you're going to get, whether you're going to get nothing at all to whether you're going to be the person who needs to take a nap, who needs to lay down, I would take the day off, but I wouldn't necessarily recommend that that's the same day that you schedule an exam, you know? So if you're gonna take the vaccine, don't schedule an exam that day, don't schedule a workout, you know, just really have it as like a day off, but there's not really any restrictions in terms of what you can eat, what you can drink, and things like that. You know, there's no restrictions like that now.
ṣé lẹ́yìn tí mo bá gba vaccine yìí tán ṣé ó ní ìbáṣepọ̀ kankan pẹ̀lú oògùn mi àbí pẹ̀lú abẹ́rẹ́ àjẹsára mìíràn lára mi? Tí mo bá gba abẹ́rẹ́ àjẹsára COVID-19 yìí kò ní ìbáṣepọ̀ kankan, kò ní ìpalára kankan tó máa ní tí mo bá gba abẹ́rẹ́ àjẹsára mi. Bóyá bí àmọ́ ṣá wa ní nǹkan kan tó jẹ́ pé tí irú bá ṣe fẹ́ gba abẹ́rẹ́ àjẹsára ti COVID-19 yìí, bóyá bí a ti gba ti tetanus vaccine yẹn, abẹ́rẹ́ àjẹsára fún tetanus tẹ́lẹ̀, a máa ní sùúrù kí ti abẹ́rẹ́ àjẹsára ti tetanus yẹn kó ṣiṣẹ́ títí ẹ̀ ná, ká má kó wọn pọ̀ mọ́ra wọn, torí pé bá ṣe ń gbà wọ́n ó máa ní í ṣe pẹ̀lú inú àgọ́ ara wa ní. So kíyẹn kọ́kọ́ ṣe títí ẹ̀ ná, kéèyàn wo nǹkan tó máa mú wá àti nǹkan tí ó máa àbájáde ẹ̀ kó tó di pé èèyàn tún máa gba ìmí. Fún àwọn ẹlòmíràn tó yẹ pé wọ́n rò pé kí ni mo lè ṣe lẹ́yìn tí mo bá gba abẹ́rẹ́ àjẹsára ìtàn, àbí kí ni mi ò gbọdọ̀ tún ṣe lẹ́yìn tí mo bá gba abẹ́rẹ́ àjẹsára ìtàn. Tòótọ́ àwọn míì wọ́n máa gbà, kò ní sí nǹkan kan tó máa ṣe wọ́n. Àwọn míì kẹ̀dẹ̀rẹ̀ tó bá gbà wọ́n máa ní oríṣiríṣi nǹkan. Ẹlòmíì lè ní ara òun gbóná, ẹlòmíì lè ní pó rẹ òun, ẹlòmíì lè ní pó yí nǹkan òun, bẹ́ẹ̀ bẹ́ẹ̀ lọ. So ẹni tó bá gbà tó jẹ́ pé bí alákọ̀ọ́kọ́ tó máa gbà lákọ̀ọ́kọ́ ẹ̀ báyìí kò sí nǹkan kan tó ṣe, ó ṣe normal, ó ṣe ó lọ ibiṣẹ́. Ẹlòmíì dàgbà pé lẹ́ǹkejì tó bá máa gbà báyìí ó máa rẹ̀ débi pé kò ní lè ṣe nǹkan kan àfi bóyá bí kó sùn, kó dùbúlẹ̀, kó ṣe. Ṣùgbọ́n ṣé àwọn nǹkan tí a tún lè sọ fún àwọn èèyàn tó yẹ pé tó bá gba abẹ́rẹ́ àjẹsára yìí, bóyá bí mo ti mọ̀ pé abẹ́rẹ́ àjẹsára mi ò, bóyá bí ọjọ́ 5 oṣù tó ń bọ̀ ni mo gbọ́dọ̀ gbà, ká rí dájú pé a sọ pé a fẹ́ ṣe àyẹ̀wò bóyá ní school o, bóyá ní ibi iṣẹ́ o, bóyá àbí ká ṣe nǹkan kan tó bá tún lágbára fún ọjọ́ yẹn, àbí a fẹ́ lọ ṣe ètò ìdánilárayá, àbí bóyá exercise àbí nǹkan tó bá ti le jù, àbí ká sọ pé a fẹ́ lọ ṣe ìdánwò bóyá nílé ìwé àbí nǹkan kan. Tá bá ti mọ̀ pé ó máa bọ́ sí ọjọ́ yẹn, ká má bùkẹ̀ sí ọjọ́ tí a mọ̀ pé ó yẹ ká gba abẹ́rẹ́ àjẹsára, torí pé èèyàn ò mọ̀, ara yàtọ̀ sára. Nǹkan tó bá ṣe èmi tó yẹ pé mo gbà kò sí nǹkan kan tó ṣe mí, ẹlòmíì lè gbà kó rẹ̀ kó ṣe, àbí kẹ́lòmíì gan tẹ̀ lóun fẹ́ sùn títí ọjọ́ yẹn tọ́jọ́ kejì máa fi tó. So ó dáa jù tó ti dá ní pé ìjọ́ tó bá ti mọ̀ pé mo fẹ́ gbà ẹ̀ kò sí a gbọ́dọ̀ tún fi ara wa sínú nǹkan tó lágbára jù tá a fẹ́ ṣe fún ọjọ́ yẹn. Thank you.
Sister Rukai, are there any more questions from the community?
I have a question. Some people ask that if people who are immunosuppressant, like if they are transplant patient, like a heart transplant, kidney, liver, or any kind of transplant, what is your recommendation for them for the vaccine?
Yeah, absolutely. So this is the answer is yes. The recommendation is to get the vaccine, but they have to do it under the careful watch of their doctor. So the recommendation will be anyone who is immunosuppressed, someone who's a transplant patient, someone who's actively on all these immunosuppressant medications, right? Someone who's receiving chemotherapy, is indeed for them to get the vaccine. And the reason why is that we worry about the risk of these people who are already at higher risk of being sick from just anything in general, right? A higher risk for being sick from any type of virus, also catch viruses and catch bacterial infections much easier than somebody else because their immune system is already suppressed, right? So we worry about these people getting the COVID virus, because when these people get the COVID virus, they do not do well, period. So we do recommend for them to get the vaccine. That being said, when you get any type of vaccination, your body needs to mount an immune response. And in order for us to know what that immune response is, we usually sit someone who is not immunosuppressed for at least 10 to 15 minutes to watch to see if they have any of those adverse reactions that we're worried about. If someone else has had like a history of like an allergy to other vaccinations or things like that, then we'll watch them for 30 minutes to see if they'll have any of those adverse reactions. For someone who is immunosuppressed, then the recommendation is to watch them for much longer to see what their body does and how their body responds to getting the vaccine, because their body is going to mount an immune response. It's supposed to do that, even though they're immunosuppressed. but because they're suppressed, it's going to take longer for that to occur. It doesn't happen as immediately as it does with somebody who has a more robust immune system. So it is absolutely recommended that people who are immunosuppressed, transplant patients on chemotherapy, get the vaccine, but under the guidance of their doctor.
Do you have a recommendation between Pfizer and Moderna on that one?
So I got the Pfizer. My brother got the Pfizer. My mom and dad got the Moderna. Basically across the board, all of our side effects seem to be similar. My brother got a sore throat. I got fatigue. My dad got no side effects at all. My mom got no side effects at all. And they both got Moderna. Both after the 1 and 2 shots. I don't personally have a preference between the two of them. The difference in efficacy for Pfizer and Moderna is Pfizer is 95.3%, Moderna is 94.1%. So to me, they all round up to about 95%. So I'm fine with either or. They both have the same, they're both the same type of vaccine, to be honest. Like, to be quite honest, they're probably the same vaccine. They're both mRNA vaccines. So understanding that they're both the same type of vaccine, which is different from the J&J vaccine and the AstraZeneca vaccine. Those are viral vector vaccines. I do not have a preference as to Pfizer, Moderna. Now, if you asked me, what is my preference between Pfizer, Moderna, J&J, and AstraZeneca? My preference is Pfizer, Moderna because of the way that those vaccines are made, because of the inherent way of how mRNA is handled in our body is that it is degraded almost immediately, and our body naturally degrades that and does not need an extra system to do that. So it's more familiar to what our body is used to doing. So that would be my recommendation, either Pfizer or Moderna.
Fún ẹni tó jẹ́ pé ó ti ní bóyá àìsàn kan lára tẹ́lẹ̀ tó pọ̀ tó bẹ́ẹ̀ gẹ́ tó yẹ pé bóyá àrùn rẹ̀ bóyá bí ẹni yẹn ti ní àìsàn ọkàn, àìsàn ẹ̀dọ̀ àbí àìsàn míì nínú ara tó jẹ́ pé ìmúùnù wọn ó ti wálẹ̀ tẹ́lẹ̀, kí ni nǹkan tí a lè ṣe fún wọn láti gba, kí ni ṣé ó yẹ kí wọ́n gbà àbí kò yẹ kí wọ́n gbà? Nítòótọ́ ó yẹ kí wọ́n gbà torí pé ọ̀pọ̀lọpọ̀ tó ti jẹ́ pé ó ti ní àwọn àrùn kan lára tẹ́lẹ̀ tó jẹ́ pé bóyá àrùn yẹn ní agbára àbí nǹkan kan, wọ́n yẹ kí wọ́n gbà torí irú wọn tó bá tí àìsàn COVID-19 yìí tó bá mú wọn, ó máa ṣèpalára tó pọ̀ fún ara wọn. So ìdí tó fi dá kí wọ́n gbà nìyẹn. Ó ṣe pàtàkì kí wọ́n gbà torí kí àìsàn COVID-19 yìí má padà kó bá má wà mú wọn, torí tí irú àìsàn COVID-19 yìí bá fi lè mú wọn, ó máa pa wọ́n lára gidi gan. So irú yẹn a dẹ̀ fẹ́ torí bẹ́ẹ̀. Ṣùgbọ́n ṣá lómìnà tún wá rò pé ṣé nínú àwọn vaccine yìí èwo ni kí n gbà? Ṣé kí n gba Pfizer ni? Ṣé kí n gba Moderna ni? Àwọn méjèèjì kò sí nǹkan kan, kò sí ìyàtọ̀ tó pọ̀ tó jẹ́ pé èèyàn rí rẹ̀ rí láàrin àwọn méjèèjì. Ìyàtọ̀ kínkínní àbí ká sọ pé bákan náà ni méjèèjì ṣe rí. Ṣùgbọ́n ṣá fún ẹni tó ń wò pé irú èwo ni kóun gbà o, ìgbàgbọ́ ṣì wà nínú Pfizer àti Moderna sí irú JJ vaccine, which is Johnson & Johnson àti AstraZeneca. So ó dáa tó bá máa gbà fún nǹkan tá à ń ro, ó dáa kí wọ́n gba nínú kó gba Pfizer àbí kó gba Moderna. So fún àwọn tó jẹ́ pé wọ́n ń wò pé wọ́n ń bẹ̀rù pé èmi tí mo ti lárùn kan lára tẹ́lẹ̀ tó jẹ́ pé mi ì tiẹ̀ mọ̀ aṣó yẹ kí n gbà bí kò yẹ kí n gbà. Fún ẹnikẹ́ni tó ní àrùn kankan ní ara, kò sí nǹkan tó jẹ́ pé wọ́n gbọ́dọ̀ fi gba abẹ́rẹ́ àjẹsára COVID-19 yìí, ó dáa kí wọ́n gbà.
Thank you, Sister Ruqayyat. Dr. Okibanjo, do you want to shed some light on JJ vaccine?
Yeah, absolutely. And I think that, it's really interesting because we had this conversation last week, right? And we were talking about J&J and its similarities with AstraZeneca. So I really want to have a really important conversation about J&J, AstraZeneca, and that these vaccines are very different from Pfizer and Moderna. So Pfizer and Moderna are mRNA vaccines. The 2-dose ones, mRNA vaccines, okay? The ones that are 1 dose are viral vector vaccines. mRNA vaccines, our body naturally degrades mRNA. So we make it naturally in our body. Our body, once it's done using it for what it needs to do, It just gets rid of it. It already has the natural structure, which is why I am very comfortable with Pfizer and Moderna, because it's just letting the body do what it would do normally. Whereas J&J is a viral vector vaccine. So what they did is they put the vaccine inside a virus that our bodies already always see. They put it inside an adenovirus, which is the virus that causes the common cold. And then that's how it's delivered into the body. And then the body then, from seeing that, makes its own mRNA and then does the next step. Versus Pfizer, Moderna kind of like skip that step. They just make the mRNA. Then they put the mRNA in you. Now, when it comes to Johnson & Johnson, it is similar to AstraZeneca. They are both viral vector vaccines. And both of them, there has been a concern for an association with the blood clots. Blood clots in certain spaces in the brain and in the splenic vein. So those are places that normally blood clots don't exist, but they do happen. And the treatment for those clots are different from how we would normally treat blood clots in the legs or in the lungs, and they're a little bit more serious. Now, there's a suggestion that there is an association, but it hasn't been proven. So the reason why J&J is on pause is to allow the government to do the research for that. It's important to know that, that's how medicine works in this country and in all other developed countries, is that if there is a concern that a medication might have side effects associated with it, they stop distribution of that medication and they start trying to see if there is an actual association with that. And if there is, then they weigh what is the risk and benefit. I'll give you an example of a medication that everybody uses, aspirin. Everybody uses aspirin. Aspirin is protective of the heart, but aspirin can cause your kidneys to fail. But we still take aspirin. Ibuprofen, we take it all the time for headaches, but ibuprofen can cause inflammation of the stomach wall. Tylenol, we take Tylenol all the time, but Tylenol can cause liver failure. So what happens with that is that when these medications have been linked to certain things, there's a pause to see if the link is real. And if the link is real, how serious is this link? And if it's serious enough that where 100% of the people who got this medication or got this vaccine are going to definitely have this side effect, right? Then usually it is pulled off the market. Then you can't use that drug. You can't use that vaccine. You can't do any of those things. But if it's not, then it's re-released with a warning. Like warning, in a percentage of some people, they can get this, when you hear all the commercials, the stuff that they say really fast, that part. That usually means that there was a pause on that medication. Now, when we look at the actual numbers of J&J has been distributed. At that point, 6.8 million people had received J&J. 6 people got blood clots. Whatever that percentage is, 6 divided by 6.8 million people, it is less than 1 in a million chance of getting blood clots. AstraZeneca had at that point been distributed to, I want to say like 11 million or something, and they had 48 people with blood clots. Do the math. Once again, less than 1 in a million. Now, you know what else causes these blood clots, these severe blood clots? The COVID-19 virus, period. And I can actually give you the percentage of people who got blood clots with the COVID-19 virus. And I'll give you some other things. So AstraZeneca and J&J, we've already said less than 1 in a million, right? Birth control pills. 12 can cause like 0.1 to 0.12% of people taking birth control pills can get blood clots. Already a higher percentage than 1 in a million. Smoking, 0.2%. And then the COVID-19 virus itself, 17% of people. So 17% of people who got the COVID virus went on to develop these severe blood clots for the people who survived. So we don't even know how many of them that the reason and the cause of death could have been secondarily to them having these blood clots. We don't know. So you have to ask yourself, am I willing to take on a risk of maybe it is associated, right? But that risk is less than 1 in a million for 17% chance that I'm going to get those clots anyway if I get the virus. amongst all the other things that the virus causes. So I think that whenever we see these things and we see these numbers, it's so easy to want to blame something and therefore say this vaccine causes blood clots, therefore I cannot get this, therefore I'm not going to get any vaccine. Let's just be clear. mRNA vaccines completely different from viral vector vaccines. These blood clottings have had no association with either or thus far, but definitely none with the mRNA, which are Pfizer and Moderna. Now look at the percentages and look at what you're willing to risk and have that honest conversation with yourself about what decisions do I want to make for myself and what am I willing to put myself at risk for? Everybody here has had the common cold. This virus spreads just like the common cold. Eventually, everybody's going to get to the COVID virus unless you're vaccinated.
I have this question from someone is there any other thing, like is there any other signs and symptoms that someone that has this blood clots are likely going to have to just know that is probably is a blood clot or something? Is there any signs for them to know?
So what I would say is this, is that if you are having within 2 weeks of getting the J&J vaccine, so that's what they're thinking that it's associated. And I'm just going to tell you the symptoms of blood clots, period, because these are all the symptoms of blood clots. So within 2 weeks of getting the J&J vaccine, if you are having shortness of breath, if you are having chest pain, if you are having abdominal pain, if when you're taking a deep breath, it hurts to take in that deep breath and you have to stop to take in that deep breath, if you're having a headache, blurry vision, if you're having pain in your leg and one leg is more swollen than another, those are signs of blood clots. The more serious ones come with more kind of like subtle signs, which is mostly really bad headache, and if you're not somebody who gets headaches, you take Tylenol, it's not going away, you take ibuprofen, it's not going away, and you just within the last 2 weeks got the J&J vaccine, you should go to the ER to be evaluated. And the appropriate thing to do will be for them to do the appropriate testing to make sure that that's not the case. So big things: headache, blurry vision, belly pain, chest pain, leg pain, or leg swelling.
Fún àwọn tó jẹ́ pé wọ́n wò pé torí ẹlòmíì wà tó jẹ́ pé tó bá ti gba abẹ́rẹ́ àjẹsára COVID-19 yìí, wọ́n ń gbọ́ oríṣiríṣi káàkiri pé ẹlòmíì ẹ̀jẹ̀ máa dì àbí nǹkan kan. A ti rí nǹkan tó ń fa ẹ̀jẹ̀ dídì gangan nínú kíní gangan ojú COVID-19 fúnra rẹ̀, yẹn àrùn tó ń jẹ́ COVID-19 gangan ó ń fà. Ẹlòmíì wà tó jẹ́ pé tó bá dùbúlẹ̀ àìsàn lórí COVID tó jẹ́ pé àrùn yìí bá mu, tó bá dé ilé ìwòsàn, wọ́n máa rí pé 70% bí ìdá mẹ́ta níbẹ̀ nínú wọ́n rí pé wọ́n ní àrùn ẹ̀jẹ̀ dídì yìí. Ẹlòmíì dẹ̀ tó jẹ́ pé nǹkan tó máa fa kí ẹ̀jẹ̀ dì lẹ́yìn abẹ́rẹ́ àjẹsára yìí, ẹlòmíì tó ń fa sìgá, tó ń mu igbó, àbí àwọn ẹlòmíì obìnrin tó jẹ́ pé wọ́n ní ètò fífètò sọmọ bíbí tá à ń pè ní family planning, wọ́n ní ẹlòmíì ni tó jẹ́ pé ó ń ṣe ìfètò sọmọ bíbí tá à ń pè ní bóyá ó ní àwọn contraceptive kankan tó ń lò, yẹn ní àwọn nǹkan téèyàn ń lò fún bóyá bí láti fètò sọmọ bíbí, àwọn náà ó ń fà á. Àti wá rí pé ẹlòmíì wà tó jẹ́ pé ó wò pé báwo kí ni nǹkan tí mo tẹ̀ fi lè mọ̀ pé bóyá àrùn ẹ̀jẹ̀ dídì yìí ó ṣe mí. Tàbárẹ́ ẹnikẹ́ni tó jẹ́ pé lẹ́yìn tó gba abẹ́rẹ́ àjẹsára Johnson & Johnson yìí àbí AstraZeneca, tàrí pé bóyá àwọn nǹkan téèyàn fi lè mọ̀ bóyá akọ̀rò bẹ́ẹ̀ ni bóyá ó lè fà kó jẹ́ pé òun ló ń ṣe onítọ̀hún, bóyá bí kí òye máa kọ́ ẹni yẹn, orí fífọ́ tó yẹ pé a lògùn, irú orí fífọ́ tó yẹ pé máa fọ́ wa láàrin bí àbí ìṣẹ́jú mélòó kan, tá bá ti lo bí ibuprofen ó máa lọ, ta ló Tylenol ó máa lọ, ṣùgbọ́n ṣá ní nínú irú nǹkan báyìí ẹni yẹn lo gbogbo oògùn tó bó pa tí mo bá lò torí bá ń fọ́ mi, ó lò kò lọ, kẹ́ni yẹn tètè lọ sí ilé ìwòsàn, àbí ẹsẹ̀ ń dùn èèyàn, àbí ẹsẹ̀ ń wú, àbí ibì kan ní ara nínú orí ní ibikíbi ó déédéé wú, ó dáa púpọ̀ kẹ́ni yẹn kó lọ sílé ìwòsàn kó ṣe àyẹ̀wò tó pé kó lè fi mọ̀ bóyá nǹkan tó ń ṣòun rẹ̀ àbí nǹkan tí kò ṣòun rẹ̀. Ṣùgbọ́n ṣá ti rí dájú pé nínú gbogbo àwọn tó ti gba abẹ́rẹ́ àjẹsára ti Pfizer àti Moderna yìí àti rí irú nǹkan báyẹn. ṣùgbọ́n ṣẹ́ni tó wá ń rí gbogbo àwọn ìpèníjà yìí lára ẹ̀ lẹ́yìn tó gba abẹ́rẹ́ àjẹsára ti bí ta sọ tán yẹn ti Johnson & Johnson àti AstraZeneca, kẹ́ni yẹn tètè lọ sí ilé ìwòsàn kó ṣe àyẹ̀wò tó pé fún nínú ẹ̀jẹ̀ àbí ní kọ̀ọ̀kan kó fi mọ̀ pé nǹkan tó ń ṣe mí rèé àbí nǹkan tó ń ṣe mí kọ́ leléyìí o.
I have another question. Would you say that the vaccines that we have here in America are better than the vaccines like abroad? Like I know like other places, like other countries, like especially like in Africa, my friend in Nigeria, he's saying that they have AstraZeneca available and a lot of people aren't getting it. Would you say that because we have better vaccines here in America, the Pfizer and Moderna, that has a role in the vaccine hesitancy abroad?
Absolutely. So I still have family in Nigeria also, and my cousin just got vaccinated, and I asked him, I was like, which one did you get? And he said that he got AstraZeneca. And my aunt lives in Nigeria, but she works for the US government in Nigeria. So I asked her, which one did she get? And she said she got Moderna. And I thought that that was really interesting because like, I don't know, we can talk about why Nigerian citizens are being offered AstraZeneca and, J&J similar, right? As opposed to Pfizer or Moderna, right? But I would personally say that medicine in the United States is better, period, in general. And part of that is because medicine in the US focuses not necessarily on preventative care, even though there has been a new shift towards more preventative care, but on treating things and prolonging life, right? Which means that we spend most of our money on medical treatments at the tail ends of our lives rather than at the beginning of our lives, because we're willing to spend that amount of money. And I think that that same thing kind of went into when it came to purchasing these vaccines. These vaccines cost different amounts. And it's clear which ones were more expensive. The Pfizer and the Moderna were more expensive than AstraZeneca, than J&J. But there are also other vaccines out there. Like there's a vaccine that was developed by China that they're given to, Chinese citizens. And my cousin said they tried to give it to Nigerians, but Nigerians said no, because it just wasn't as efficacious, right? So I do believe that out of all of them, Moderna and Pfizer are the more expensive ones, but also have the highest safety profile and highest efficiency as well, followed closely by J&J and AstraZeneca. Like I said, if I had a choice as to which out of the four I would get, I would definitely just get Moderna and Pfizer. But it's what's being offered. Now, at this point, though, any vaccine is safer than having the virus. And I think that that's what's really important, is that unless you plan on living in a bubble for the rest of your life, and even if you did live in a bubble for the rest of your life, you probably still could not avoid getting the COVID virus. You don't want to put yourself at risk of getting the virus in a developing country where healthcare is not what it should be, and then putting yourself at risk. So if the offer is to get AstraZeneca or J&J and have a 67% effectivity protection rate over a 0% effectivity protection rate, then I would go with the 67% personally. Oh, we lost her.
Yes.
This is very very informative, Dr. Okabanjo. The extremely informative session today. We're hoping to clip different questions and put it out there. Hopefully you don't mind us clipping out your comments and then translating. And the questions that weren't translated live by Sister Rokayat, then we would like to have her translate these and possibly then put it out there, inshallah.
Yeah, absolutely. No problem. And if you have any other questions, just send them my way. I'll answer them, and you can feel free to translate them as well.
Okay, no, thank you for the very informative. Sister Atia, do you want to?
No, I just want to say thank you. I had a lot of questions and I got some answers. So thank you very much.
Absolutely. You are so welcome. And I mean, I think we just have to keep having these conversations. And the really, really unfortunate thing is that right now we're seeing a lot of really, really young people with COVID, and they are not doing well. And when I say really young people, I'm saying like that group of 19 to 25. And they're not doing well. So whatever can be done to encourage that group of individuals who at the age of like 18 to 20, right, to 25, like you feel invincible. You feel like nothing can get you. You feel like it's just a virus. Why would I get this vaccine? Other than appealing to, you want to get the vaccine to keep yourself safe. You want to get the vaccine to keep your parents safe, your grandparents safe. But you also don't know what can happen to you. And having to look a 22-year-old in the eye and tell them that we have to intubate them because they're doing a bad job of breathing on their own is horrible. We expect to have those conversations with older people who have multiple medical problems. We don't expect to have them with 22-year-olds. So I will advocate for like whatever you can do to just continue to spread the word, especially in our younger population, that they don't know what COVID is going to do to them. Keep themselves as safe as possible, continue to wear a mask, and get the vaccine when they're able to get it. Okay, awesome. So I'm going to jump off. Thank you all so much for having me.
Thank
I
you.
really appreciate it.
Thank you.
Thank you, Dr. Thank you so much, Dr. Okavanjo. It's been a great session, and we loved it. And thank you. We love you too.
Good. You guys
Thank
have a
you for-
wonderful evening.
for taking the time out and really explaining these things, and making sure that it gets translated. This is community health indeed.
No, thank you. I really enjoyed these sessions. You all have a wonderful evening.
You too. Have a good one.
Thank you.
Thanks. Bye. Thank you, Thea.
No problem.
Thank you, everybody. Thank you, Tiberia and Asnan, Uruj.
Thank you.